Good evening, everyone. Welcome back to another live session of Cancer Care at American Oncology Institute, Ludhiana. Today, we have with us Dr. Suvir Singh, Associate Professor, Hemato Oncology and Bone Marrow Transplant. Today, we will discuss about bone marrow transplant in multiple myeloma. Sir, welcome back.
Thank you.
Sir, what is multiple myeloma and what is the incidence?
So multiple myeloma is basically a kind of blood cancer. It is one of the commonest blood cancer that we see in our population. So incidence, if you see some studies, it's almost one patient every 1 lakh population. So almost 8,000 to 10,000 patients are diagnosed every year in India itself. So it's pretty common, and we do see a lot of patients who come to us for treatment.
Ji. Sir, how do you diagnose a case of multiple myeloma?
So multiple myeloma, the main issue is that because it can have varied manifestations, it can sometimes affect kidney, bones, blood. So many times the patient actually will land up in different departments for review depending on which are the predominant symptoms. So the most important to remember is that all patients where myeloma is suspected, these will include basically patients who have an unexplained decrease in the hemoglobin, blood can go down, or they can have a rise in the creatinine or decrease in the urine output, or they can have swelling all over the body or in the legs. So these are common symptoms. Apart from that, you can also have patients who can come with bony symptoms. For example, fractures without any history of injury or fall. Right. They can have onset of severe back pain and difficulty in walking. So these usually will lead us to do initial round of tests, which will either show us anemia or increase in the creatinine, increase in calcium, or increase in the total protein in the blood. So whenever this is suspected, we have to get a bone marrow done. So that is the most important point here, because without a bone marrow examination, we cannot be sure if the patient has myeloma or not. So bone marrow examination has to be done, and some tests have to be done in the blood and the urine to decide whether there are any other features to confirm the diagnosis of myeloma. A small percent of patients actually may not have anything on the bone marrow or in the blood. So in these patients, we'll have to get a PET scan for diagnosis. But otherwise, PET scan usually we do just for kind of staging and assessing the burden of disease.
Okay, sir. Sir, what are the treatment modalities available for treating the disease?
So myeloma, basically now a lot of new agents are available. From 2016 itself, we have around 5 or 7 drugs, more than that actually, which have been approved for myeloma. So the main thing is that we should start with combination chemotherapy, and all patients at diagnosis should be assessed whether they are candidates for an autologous bone marrow transplant. So that is one of the most effective and cost-effective treatment for patients in India. So initial treatment is usually with some chemotherapy, a combination chemotherapy, and after 3 to 4 months, if the patient is fit, we take them for a transplant, and then from there they are either put on a single oral tablet or injection, which continues indefinitely till the disease is in control.
So the next question is, what is bone marrow transplant? What are its types?
So bone marrow transplant, there are 2 types mainly, allogenic and autologous. Allogenic is when we take cells from another person or a donor and give it to the patient, and autologous is when we use the patient's own cells. So both have different indications. The most common indications for autologous transplant are myeloma and lymphoma, which have either relapsed or as part of routine care. And allogenic usually is done for diseases like high-risk AML, thalassemia, aplastic anemia, and other high-risk malignancies after relapse.